My name is Dr. Amit Sahar. I'm one of the consultant rheumatologists at Benenden that sees any patients with any major rheumatology conditions that's referred to me. Well, rheumatic disease is a pretty broad definition of all the diseases that rheumatologists treat. Predominantly, it would be based on diseases that affect the joint. So when people complain of joint pains, be it wear and tear, inflammation, that normally comes under the responsibility of a rheumatologist. So that's a very easy definition. But sometimes rheumatic disease not only affects the joints, but it can affect the whole body, say in lupus, where there can be inflammation in any organ. So sometimes patients will complain of some joint problems, but a few other things, and that still comes under the responsibility of rheumatology. So I'd say a rheumatic disease is any disease that affects the joint, and most diseases that have an autoimmune element would also fall under the definition of rheumatic disease. The most common rheumatic conditions are wear and tear, pain that you get if you do too much activity, a dodgy back, painful knees, neck, hands, feet, and that's very commonly seen by myself at Benenden and very easily diagnosed, and we can start a very easy treatment plan within 1 or 2 consultations. The second one, which is less common, but is the one that we want to get treated sooner rather than later to prevent damage, is autoimmune rheumatic diseases, say rheumatoid arthritis, where there's inflammation in the joints, and if one doesn't get treatment started very quickly, there can be long-term damage. So I would say that's probably the second most common condition we see at the Benenden. Well, all these conditions can affect any gender, any age. But in rheumatology, unfortunately, it's usually females that are more predominantly affected by the autoimmune disease. And with most of our diseases, as one ages going from 40, 50, 60 plus, you're more likely to get these issues, especially the wear and tear pains. The most typical symptom that the patient complains to their GPs and that they mention to me and to my colleagues is basically pain. Pain usually focuses around the joints, but it can be any part of the body. So I would say that's the predominant thing. And if it's associated with swelling, that makes it more likely to be something autoimmune, which makes it more urgent for us to be seen. So pain and swelling in the joints, I would say. There's treatment for all the rheumatic conditions we treat, from simple wear and tear to rheumatoid arthritis to lupus. So we can treat all of them. With regards to the most common ailments that people suffer from, be it joint pain due to wear and tear, we can recommend and we can prescribe the whole array of painkillers. And for joints that just need a one-off solution, we're very happy to inject the large joint, or can arrange for injections to occur under ultrasound guidance by our colleagues. Well, the biggest advantage I find working at the Benenden is that we try to get everything done within 2 consultations. So we try to get everything done very quickly. So normally what happens is the patient will come, describe their complaints, we'll have an examination, and on that day we'll arrange blood tests and simple imaging such as x-rays. If they need something more complicated, they will get an ultrasound scan, CTs or MRIs, or even bone scans under the auspices of Benenden within a week, 2 or 3 or 4. And then I'll have a follow-up, and then with those investigation results, we'll usually come up with a diagnosis and a treatment plan. The reason I would recommend coming to the Benenden is predominantly, one, you get to see a consultant with usually 5 to 10 years experience with regards to rheumatology, and not only that, you get speed of access, which is one of the main advantages of coming to the Benenden. You will see a consultant very quickly, and you'll get your tests done much quicker compared to other places. So we'll come up with a diagnosis and treat plan as soon as possible.